Hello, this is Dr. Gay from First Look MRI, and this is a 62-year-old male with complaints of shoulder pain. He's got a few findings, but one of the main findings here in the front of the shoulder. So to get oriented, this is the humeral head, the round ball. We see a little thing that looks like a golf tee here. This is the glenoid, part of the scapula. And along the front, which is here, we see a muscle, the subscapularis muscle, one of the rotator cuff muscles, this in the front. And we see a black line, that's the central tendon coming out. And we see this central tendon coming into the main subscapularis tendon, which is going to attach over here. And this part is called the lesser tuberosity. And we can see that the tendon does not look normal. It looks good here, and from here on out it starts to fade. It looks not too bad on that one, but on this one, very thin, irregular. And if we go down to this one here, very thin. And on this one, there's bright signal here. This is some fluid undermining it, so an undersurface tear, a high-grade partial, almost a full-thickness undersurface tear of the subscapularis tendon at the attachment to the bone. And the bone is irregular and jagged here. And there's also a little component that goes over the top of this. This is the biceps tendon. This is the bicipital groove, so the subscap has a little component that goes over the top called the transverse ligament. That one's a little attenuated, probably partially torn. But in this case, when we see a partial tear of the subscapularis tendon, or a complete tear for that matter, we want to look at the coracohumeral interval. So that's the space between the humerus and the coracoid process. This is part of the scapula. This is the glenoid. Here's the coracoid process here. It wraps around the front. And there's a distance here that should be about a centimeter or so. And when it's narrowed, especially less than 6 millimeters, we get really nervous that the subscapularis tendon may be getting pinched, especially when they internally rotate their shoulder. This will rotate inward and pinch that subscapularis. So this is less than 1 centimeter. If we measure this, it is about 4.5 millimeters. So this is a case of narrowing between the coracoid process and the humeral head, the coracohumeral interval. It's way too low. It's way less than 1 centimeter. It's half that. And this leads to what we call coracoid impingement, pinching of the subscapularis tendon, and this patient has a high-grade partial, almost a full-thickness tear related to that. Coracoid impingement. Thank you very much.